and welcome to Doctors New Orleans, where you get to see firsthand how some of our local leading healthcare experts tackle health issues that are important to you. I'm your host, Maria Muro, and each week our goal is to help you take charge of your health. On tonight's show, we'll cover a range of health topics, such as holiday heartburn. All right, welcome back. The holidays are here, and with that comes a lot of rich foods and large meals. Holiday overeating can actually worsen some common conditions, such as acid reflux and GERD. Tonight we have Dr. Vivek Hulgal. He likes to be called Dr. Viv. He's a local gastroenterologist here at Touro Infirmary, and thank you so much for being here.
Thank you very much for inviting me.
So like I said, everybody, he likes to be called Dr. Viv, which is a little easier. Okay, so Dr. Viv, let's talk about you first before we start talking about this overeating that we all like to do at the holidays.
Right.
So you're a gastroenterologist,
Yes.
And tell me about, these, I know you've taken a new journey in your career. Tell me about that.
The commuting's difficult. Life is, full of challenges. We have some young children, and really decided that it'd be better to focus my interests, here in New Orleans, and decided to take the gamble and go out on my own. And Touro has been very gracious in providing me with some assistance to accomplish that. And
Fantastic.
we're going to go out with a Nolo Gastro kind of brand name, and offer very personalized service. I think
Wonderful.
that's not part of the corporate entity anymore. So.
Well, that's great, and having a partner like Touro, who's obviously very connected in the community, and very established, and has been around for many, many years.
Yes.
And I think you'll be part of a good family of physicians.
Yes.
and great staff and support. And I work with them very closely. So congratulations on that.
Thank you.
So as a gastroenterologist, I know that you treat many different issues, digestive issues.
Right.
What are the most common ones that you treat?
Probably the commonest complaints that come through the door are those relating to heartburn, indigestion, abdominal pain, or concerns about bleeding, worries about colon cancer. Colon cancer is, of course, a very common entity in the United States. It's the second leading cause of cancer death. And so anything we can do to prevent that risk or diminish that risk through screening colonoscopy, for example, is critical. Screening, of course, means that you have no symptoms. You have nothing going on. So it tends to be an age-appropriate thing to do. 50 and over is certainly widely recognized as a benchmark for having colonoscopy. There's some discussion that African Americans who seem to be at slightly greater risk for colon cancer should probably start at age 45. Mm-hmm. So this is in the absence of any other risk factors. Now, if you have a family history or some other, uncommon conditions, it's something that should lead to a discussion between you and your physician. And it may well be that you need colonoscopy earlier than that. The beauty of colonoscopy, and this is what really I still get a kick out of, is you look inside the human body, you can take care of things for people and largely, change what's going to happen, like in a positive way.
Absolutely, and having great communication with one's physician, and the importance of screening, obviously, will help patients get treated earlier should there be a problem.
Early detection.
We're all about early
key.
Detection and screening. So, and you have to be proactive when it comes to your health. All right, so now it's time for the holiday season, and I'm telling you, I get a lot of heartburn during the holidays because I just like to eat from the morning. I mean, just very rich foods.
Right.
Okay, and we're in New Orleans. So besides it being the holidays, we already eat rich foods in our wonderful city with fantastic restaurants.
Right.
Okay, so let's talk about the triggers. Okay?
Well, the food culture here is wonderful, and those rich foods, the thing to bear in mind is that the body, we need a certain amount of fat in the diet, and the body's used to handling fat, but the way in which it handles it is it slows down the rate of emptying from the stomach. So if you've eaten a rich meal, you need to stop. You need to let the body, the stomach specifically, send out the hormones to the brain that says, hey, we've had enough calories, we've had enough intake, we've had enough food on board. And the problem with the holidays is that emotional tie-in with eating. We all love to eat.
Sure.
I mean, it's very much a social activity as much as, a physiologic necessity. So, we tend to overeat because of the social milieu and enjoying those extra specialties and the delicacies, at that time of year.
And cocktails on top of it.
Absolutely.
So, definitely, and I think the cocktails can definitely make the heartburn worse, right?
Right. I think cocktails were invented in New Orleans, so, we have something to be proud of.
Oh, we do. Okay, so let's talk about actual heartburn. What is it, and how, why does it happen?
Well, heartburn's a sensation of really liquids largely pushing back from the stomach up into the esophagus. And so it tends to go by the acronym GERD, which is gastroesophageal reflux disease. The gastro, of course, refers to the stomach. The esophagus is self-evidence. The reflux is that the fact that it's going in the wrong direction, and then the disease is the symptoms that it can lead to. It can lead to structural damage. It can lead to long-term problems for people, but often it's just that very uncomfortable sensation of a burning sensation in the lower chest that's uncomfortable and unpleasant, and people want to do something to treat it or avoid it.
Is that the main symptom that one would experience, is just that burning sensation?
Absolutely. Now, some people notice an increase in belching or just a vague heaviness can be a manifestation. People who are anatomically prone to reflux, for example, maybe they have a hiatal hernia or something like that, they're lying flat, of course, overnight, and then in the mornings, one of their symptoms may be nausea, in the same way that pregnant women experience nausea from the hormones that are elaborated to enable the uterus to relax, also relax the lower esophageal sphincter and predispose, women to heartburn during pregnancy.
Okay. And now, Dr. Viv, are there any foods that trigger heartburn or GERD?
Well, high-fat foods, I think you've identified that. I think other triggers are stuff that people have usually identified for themselves. So it might be citrus or tomato-rich foods.
What about chocolate?
Well, chocolate's kind of a mixed bag. Chocolate's great. It may even be cardioprotective, may have some really terrific benefits to it. But it tends to come in a high-fat kind of compound, so that can lead to that slowing of stomach. But specifically, chocolate does help to relax that lower esophageal sphincter. The tradition of an after-dinner mint, great idea. If you're eating normally and you have an after-dinner mint, it relaxes that sphincter. It might enable you to belch and just ease some of the fullness in the stomach. You're going to feel a lot better. That's where that tradition comes from. But unfortunately, if you're prone to reflux problems and you have that same after-dinner mint, or maybe some chocolate cake or something fantastic at Christmas or in the holidays, you're going to regret it, because it's going to relax that muscle and lead to more problems. Okay,
and now what about during the holidays, of course, should we eat meals a little earlier in the evening? Because I would think that most of the heartburn will happen in rich meals, but later in the day. Is that true, or does that time of the day, or how many hours should you eat before you go to bed? Does that have any effect?
Yeah, I think certainly eating late, eating big meals and then going and retiring can get you into trouble. But the typical scenario at Thanksgiving is you've had that great lunch and then you lay down on the sofa and sprawl out and watch the NFL. So it can happen any time of the day. Certainly posture does unfortunately play a role, in that.
All right, and obviously everybody's taking Pepto-Bismol and other different, over-the-counter remedies. What are your thoughts on that, as to when is it appropriate to, maybe have some different home remedies, and when is it time to seek medical attention?
I'm really all for the simple measures. If you're using Mylanta or Maalox or Tums or Rolaids, simple antacids that have an immediate effect and they work for you, fantastic. I generally probably wouldn't want you to be taking those on a daily basis for any more than 2 weeks. If you're doing something for more than 2 weeks in a row and you're not getting any symptom relief, there's something else going on, and it needs further investigation.
Okay. And so for for those viewers watching the show tonight who've had prolonged, a lot of us don't know the difference. Is it acid reflux? Is it GERD? Is it heartburn? But if it's something that you're so used to living with, and if left untreated, what are the complications or risk factors involved?
The feared thing, the thing that we worry about, is it does definitely increase your risk of esophageal cancer. Now, it's a small absolute risk, but the relative risk increase is really quite dramatic. And this is one of the reasons why, in the same way that we're talking about screening colonoscopy, we also talk about doing screening upper endoscopy to look at the esophagus to make sure that there's been no change in the lining of the esophagus. This was identified a long time ago now, and by 3 different physicians at the same time, but Dr. Barrett got the credit for this. And so these changes in the lining of the esophagus are often called Barrett's esophagus. And we worry about those because there's certainly good data that shows that predisposes people to increased risk of esophageal cancer. If you're failing to get relief with those simple over-the-counter antacids, it's certainly prudent and reasonable to try some of the now readily available over-the-counter stronger medications like omeprazole, which is now available on a generic basis and is relatively cheap, or other medications in that class, which are collectively known as proton pump inhibitors. But again, I caution you, if you're using them for more than 2 weeks in a row, you probably should seek attention. There are long-term side effects from those medications. So like most things in life, there's a trade-off to be made, and it needs to be done in conjunction, preferably with your physician, after a good think about why we have stomach acid, how it does enable us to digest food. Do we really want to be turning it off, you know, for a long period of time? What are we trying to accomplish?
And doctor, what about your patients? If someone is overweight, are they more prone to developing heartburn or digestive issues?
Yeah, there's certainly some factors there. I mean, some of those are just simply mechanical. If you have a large belly weight or mass that is pushing physically on the stomach, which is of course lying within the abdomen, it is going to make reflux a little more prevalent, for sure.
All right. So final words, because we got to go, Dr. Viv. The holidays are here. Give us some, some final words of advice on staying healthy. Well, you could still splurge a little bit during the holidays,
right,
and not having to run to the ER, because a lot of people think they might be having a heart attack, right? When they're having, it could be.
Can
does
happen.
that happen? Okay.
Absolutely. If you have a severe attack of indigestion, it could be a heart attack, and maybe you should take one aspirin and think about calling 911. But try and keep it in perspective. In terms of the holidays, enjoy them. Like everything in life, enjoy in moderation.
Fantastic. And Dr. Viv, we wish you a ton of success in your new endeavor, and congratulations.
Thank
you. We look forward to having you back on the show. Thank you so much for being here.
Thank you for your good wishes.
All right.